This is where a 30-year-old police officer took their life on Thursday. It was a shock. This was an officer known for hard work and friendly ties with the rest of the squad. The police force thinks this was a hidden mental health crisis that reached a breaking point. This is not an isolated case. It's already the second suicide of the year in the police force, putting Taiwan on track to overtake its yearly average of 5 police suicides. Taiwan's government watchdog says the problem of police suicides is getting worse, and the age of the officers taking their lives is getting younger.
警察有他的绩效压力，有他的排班的特性，他可能3班制，所以他很容易会造成他的身心的健康上的一些风险在。在22件里面有6件都已经陷入到所谓的长期失眠的困扰。
Mental health is covered under Taiwan's national health insurance, but suicide prevention resources for the police force are underfunded.
一年能够投入在这种自杀防治的工作，它大概只有370万这涵盖所有县市，包括警政署。当然，这个预算占它的整体警政署的预算来说，连1%都没有。
Officer Xiao Renhao knows well what this can lead to. A member of his police academy class is among those to have taken their lives in recent years. Xiao is now one of the directors of a group that pushes for officers' labor rights and surveys their mental health. An unusual workload last year brought the percentage of officers who said they'd considered suicide to 11%.
我们都会说，警察在工作之后，他会慢慢的跟社会脱节，就是因为他没有时间去做其他的事情。那另外一个部分就是说，警察会是一个需要比较常面对冲突的工作，会定说就是你可能要开多少单，那你要抓什么特定的犯罪，你要查多少案件。我们都会说它是一个很不合理的制度的原因是，我们都会说台湾是治安很好的国家。
Xiao says those who seek help aren't as stigmatized as they used to be, but they can still face consequences that can make the situation worse if they're open about it.
那就是要求你不要拿枪。但是这样其实会有很大的影响，因为我们大多数的勤务都会需要配枪，它就会变成连值班都不能值班，因为值班是要配枪的，他就只能可能顾大门，或者是做一些简单的勤务，他就会变成这个单位内跟大家脱节的人，因为他的勤务跟大家完全不一样，他会是对于工作状态有影响，你就会觉得到底是他不想工作，他偷懒不想工作，还是因为生病，就会分不清楚。
Xiao says conditions are far better than they once were, but officers continue to die. And his group wants measures like the abolition of fine quotas to help ease the pressure of the job. The National Police Agency didn't respond to a request for comment on these issues or on how it plans to improve officers' access to mental health care. And while the Control Yuan wants more spending and more counseling capacity, concrete plans for the mental health of Taiwan's 70,000-strong police force aren't yet in sight. Dolphine, Chen, and John Van Trieste for TaiwanPlus.